Hey, my friend, what's going on? Today I'm really excited because I get to interview Dr. Thierry Hertoghe, who's the president of the International Hormone Society, and he's a world renowned expert and authority on all things hormones, anti aging medicine, but also how to reverse and extend human lifespan. He also represents the fourth generation of endocrinologists, which I didn't even know existed. But in this episode, we talk to him all about male and female hormones, when you should supplement with those hormones, and who should do it. Stay tuned. Good afternoon, everybody. I'm here today with Dr. Thierry Hertoghe, who is the president of the International Hormone Society. He's also fourth in line generationally of doctors that have been treating people or helping people with hormone and endocrine disorders. He's based out of Belgium and has a team of doctors at his office that he works with, and he's quite the international expert on anything hormones, nutrition, and just balancing your body and living your best life, including reversing the signs of your aging and living a long and healthy life. So I'm very excited that he is here with me so he can answer some questions and we can learn about how to reverse our age and live a long life. So Dr. Hertoghe, please tell us a little bit about yourself and how you got into medicine.
Thank you. Well, I had no choice than getting into medicine, in the sense that the impression I had is that I was the fourth generation. My father always tried to give me some medical information, and so I hated, actually, and I tried to do other things. I was very early that actually I tried to think what I was going to do of my life, and at age 17, because I was 1 year before in my at school, I went finally to university to do medical school because I didn't know what other to do, and I was successful the first year, and then I had a sort of I would say change of mind and say, this is not my life, I'm not going to do the same as my ancestors. So I actually dropped out of the school and of university and went to work in a factory with my hands. I did a lot of different works which I actually liked a lot. And basically then I said, well, now I'm maybe ready I'm ripe to do medicine. So I did medicine, and when I finished medicine, I decided I would do psychiatry, to be certainly nothing to do with the hormones. But when I saw these people in psychiatry, they were hormone deficient. They were not getting the right treatment. So I said, ethically, I cannot continue there. And so I went to work with my father, and I went into business also at the same time. Business didn't work. Everything I touched in medicine later worked, but not other things. So basically I thought this is my destiny, and I became passionate about it because I saw really impressive results with these therapies with hormones. We had a person who was completely bald-headed, a young person, a young adult of 18 years, went everywhere, nobody could do it, and in 2 or 3 or 4 months, we got his hair back. It was so amazing. So I was very quickly passionate about this medicine. I really thank God that I'm in this section. But my father suffered a lot of the controversies because he was giving easier thyroid therapy, for example, than others. So I went into science in the sense that I collected data, and then I found that there were a lot of other hormones that were doing also strong effects. So I broadened the field, and I went into many hormone therapies, and I found that this is the right thing to do, and that is also the reason why I write books, so that many more physicians can be familiar with these treatments and treat their patients.
Wow. You went to work in a factory, so you don't have to follow the line of your ancestors. But as fate would have it, you came back to do this, to make a difference in the world and help people where they're most effective. So you have a philosophy on life extension, living a long life, and age reversal. I would love to have our listeners or people that are watching hear that philosophy. Can you please explain it for us?
So, well, let's say that my philosophy is that our life is spiritual. We're here for a spiritual meaning, and so we have a job to do where we will develop ourselves and we'll help the other people to develop. And basically, the medicine I do has the possibility not only to make people have a better quality of life so they can be free of parasite emotions and really do what they should be doing here, but also extend life so they can have a longer period to do that good job that they have to do in Earth. I really think that I'm privileged to do that, but also to find also always new ways. And I personally, maybe look strange for you, but I think it's like an inspiration. It's not me only who doing it. I'm pushed by a sort of force. People will call that God, others will call that nature, or whatever the force is. It's a very good force that I think is positive, that everybody has. We just need to unblock that, and we can also do great things.
That's amazing. So if we dive into a little bit of the strategies that you use to help people live a longer life, live a better life, but also reverse aging, is it mainly through hormones? Is it mainly through nutrition? Is it lifestyle? What are your key pillars that you use?
I think you all mentioned almost all the important things. Is that it's basically due to a multiple approach. The hormones are very important to keep your looks young and to stay healthy, and they may live longer, maybe 20 years, possibly. We don't have definite proof. We have very strong indications, 20, 30 years maybe, but it's not enough. I've just given a lecture this morning in the FRM meeting where I was talked about the psychological attitudes of centenarians, and actually they have a lot of positive psychological attitudes. For example, they are not afraid of becoming old. They want to live. They like life. They are very cheerful. They are very sociable. They have a capacity to cope with stress, that where they are more relaxed, they don't are not in conflict with others so much, and they don't attribute the fault when they are in problems to other people or to the world or to injustice. They always think everything is an opportunity to make something out of it. So I've been inspired by those centenary psychological attitudes. It's very important to have those positive attitudes toward life. And when you have a positive attitude, what happens is you take good care of yourself. So good care of yourself is you're not going to overwork, or you're not going to avoid doing sports and sitting on your sofa looking at TV all the time. You're going to do very positive things for you, and you're going also to go to a doctor that can correct your deficiencies with natural molecules and not with drugs that treat the consequence. You're going to treat the cause. You have a clear thinking. So it's basically a lot of things. You also have to avoid pollution. So you drink water, you don't drink alcohol. If you drink alcohol maybe once a week, but you're not going to do it every day because that's bad for your hormones and things. So it requires education. You need to know what really works, and there's so many confusing information. That's one of the reasons I try to write books that are well structured with a lot of extensive information and with the proof, the references, so that you get the conviction of it, and you get mostly convinced about these treatments when you apply them. So I would rate, if you have to do a rating, is that the first thing is be positive, and meaning also spiritual. Try to get a sort of time for meditation and being really in the present time, not being thinking all the time. Feeling. Living is feeling. It's not thinking. Thinking is existing. You don't live when you think all the time and you about problems. So you're in the present time. You focus in the present time. You're positive, and then you eat well and you drink well, and then you add nutritional and hormone supplements that correct your deficiencies that are inevitable with aging, inevitable because nobody is perfect and born perfect, so inevitably you have to do it. And then you avoid pollution, and with that you have already, I think, the most important points to live probably a very long life.
Okay, that's great. Now, you mentioned some pieces of it, but I'm going to ask you again in a different question. What are the reasons, or why do people age, in your opinion?
Well, people age because there's a tear and wear process that is inevitable, that is accelerated maybe by unhealthy lifestyle. But people age also because in the tear and wear process, the biggest factor is hormone deficiencies. And among those hormone deficiencies, the most important one is growth hormone and IGF-1 deficiencies. When you have those deficiencies, life can be shortened by about 20 years time. A pack of studies show in that direction. So basically, if this deficiency is severe enough, so you need to treat those deficiencies, including the sex hormone deficiency. They have a little lesser effect to counter aging than growth hormone and IGF-1. There are many other hormones like thyroid, even cortisol can be a protective hormone if it's to treat a deficiency, and DHEA, pregnenolone, and all these hormones also have a place. So it is a multiple hormone deficiency. For example, I'm 62 years, so I take 15 to 16 hormones, depending, but it's the small amounts, but that makes a big difference.
Wow, you look great for 62, first of all. And I didn't realize you took 14 hormones, so that's great to hear.
Yeah, at least 14. Yeah.
Wow. There's some recent research published by Dr. Walter Longo and others that talk about the benefits of fasting and reducing the growth states of the anabolic states of an animal or the mammal or humans, and how that could be beneficial. So that would mean suppressing IGF-1 and growth hormone in cyclical phases. What is your philosophy on how should we suppress and how should we increase?
Well, let's say, I think Walter Longo has done fundamental research that is very good by fasting and intermittent fasting. It's very, very good research. I do think he gives misleading information because, for example, he says that you need to reduce IGF-1 to live long, and it's based on my studies. And there's only 4 studies in humans that may indicate that, but there's about 30 studies in humans that indicate the higher the IGF-1 levels, the longer you live. So I think he's just given a fraction of information, and he says that there are some people who are born with low IGF-1 and they live a long life. That's not true. They live a life like we do. They don't live longer. And those people, nobody wants to look like them because they are dwarfs. They have flat faces. They are disformed because the body is lacking something. And when you have an IGF-1 deficiency, what is disregarded by Walter Longo and colleagues is that the patient suffers from exhaustion, a sort of lower mood, and from atrophy, and is not able to do much. There's not much insight in the brain because you need the higher IGF-1 levels, the more you're the big boss, the leading figure. So basically, it's based on fraction information. He's not a bad researcher, a bad man. He's very good in his field, but he extends a little bit too long, and he should probably get some advice from physicians with me who work with IGF-1. I inject IGF-1, I take it myself, and we see the difference in patients. Sometimes amazing how much better they feel and better they look, and it matches the data. Most of the data is really in direction. It's curative, even against many forms of cancer. So I think you have always to do a review of the literature and not based on what you want to show. And in intermittent fasting, it's true that IGF-1 decreases, but did you know that the number of receptors for IGF-1 increased dramatically? So basically, it's completely compensated by high amount of receptors and a higher receptor binding to IGF-1. This information should also be given by those researchers. I don't know why they disregard it. I don't.
Okay, great. So let's dive into now. A man in peak physical condition, maybe in their early 20s, it looks great, but as we age men, we start losing key hormones. Are there particular hormones that men are susceptible to degrading or losing more so, and which ones might those be?
Well, men will lose the same hormones as women, but because they have more testosterone, they will lose more testosterone than women. But anyway, it's slower because the decline in testosterone in women, the male hormone, actually is very quick, 50% less from age 20 to 40 years, while in men it is just 15 or 20% less. So he has a bigger capital of things. But men have to remain handsome their whole life. They don't have to be aging. If a person looks older, is a person that's less healthy. So any decline is not good. It's like I call it negligence or maltreatment. We have beautiful homes, beautiful cars. We take good care of them, and we don't take good care of ourselves. And especially men take less good care of themselves as women. So I would say the most important hormone that men should first think about because it has a fantastic advantage is testosterone, the male hormone. That hormone that masculinizes him is also a hormone that stimulates the secretion of many of the other hormones. So just by taking testosterone, you already improve the whole endocrine system or whole hormone system. So that is the minimum hormone that a man should take once it's declining, and it declines very quickly. Did you know that every 4 minutes we are losing one cell in net loss of Leydig cell that produces testosterone in our testicles? So basically it is impossible that next year you have the same testosterone level than this year. So every year there's a further decline. It's very slight in the beginning, but it's worth treating. So I think most men should be treated from age 30 years on with a little testosterone, and then it slowly increases with time. And the other hormone is that DHEA is decreased from age 30 years on also. That's why men lose pubic hair and armpit hair from age 30. So DHEA has to be given. Then there is also growth hormone. Growth hormone is a major hormone that makes us grow, but once you're tall, you still need enough growth hormone to keep the tallness and to keep the body firm. And that hormone decreases also from age 30. So I should have started growth hormone at age 31. I only started at age 38. So I suffered between age 31 and 38 of a sort of fatigue, a lack of recovery. I needed longer time to sleep, and had a sort of nervous sleep, superficial sleep, just because I didn't treat my growth hormone deficiency. It's unnecessary suffering, because taking the hormone will not damage the gland. The gland will be spared. It will not tear and wear so much over time because it doesn't have to overwork. And so it's time to treat those deficiencies. Melatonin deficiency also decreased quite quickly. So men should certainly, after age 30 or even sooner, take melatonin. I should have taken it in my childhood because I was a very poor sleeper. And with melatonin, I sleep like a baby, actually. So very good.
So a man in his 30s might consider taking testosterone, melatonin. What about growth hormone? And
growth hormone too, actually. Maybe they start first with testosterone and melatonin that boost the secretion of growth hormone, and DHEA also. And if there's still some physical signs of low growth hormone, he should then correct his growth hormone. The physical signs would be an atrophic hand, for example, or a little sagging cheeks, little sagging the eyelids. Could also be fat accumulation on the belly. If that doesn't appear with testosterone and DHEA, then they go over. Often thyroid is also deficient in these men, so you need to take also thyroid hormone, but that is often, even in childhood, often the case.
Okay. What about men in their 40s and 50s? What should they be adding on top of this protocol?
Basically, it's the same hormone. They have to increase the doses. There might be some adrenal deficiencies. They get burned out from their work, for example. They have overworked and the adrenals are deficient. They become cortisol deficient. So that might have to be added. Also, IGF-1 becomes to be important from age 40 to 50. That's another sort of growth hormone that thickens the skin the most, thickens the hair. My hair tripled in volume when I started to take growth hormone at age 52. And it also gives thicker muscles and better muscles. It reverses the atrophy of all those areas, actually.
Okay, great. What about women? What hormones start declining in women, and by what age?
So in women, we have a decline from age 30 also of the sex hormones. The two female hormones are significantly lower levels in women above age 30 in most. And after pregnancy, even it's worse. So they need mothers, women who look like mothers are actually older women due to a lack of female hormones. And you give the female hormones, they look back as the young women when they look before. They need also a little testosterone, even quicker than men often, because the levels decline. DHEA they might need, and it's often thyroid hormones. That's why they have a weight increase often because of low thyroid, and they get a puffy face. So those are the hormones that are necessary, and maybe for also, so from age 35, 40 start with growth hormone, and age 50 IGF-1, for example. Melatonin very quickly. Age 30 you need to start also, or earlier. So it's very similar to men, except that women take female hormones extra that you don't generally give to men, at least not the estrogens.
Okay. Why are you a fan of the Paleolithic diet?
I'm a fan of the Paleolithic diet because it matches, it gives better hormone levels. It also matches of what our body is accustomed to. We still have a prehistoric body. I know we're very proud of ourselves, but we look like almost a Neanderthaler or a Homo sapiens. We're not so far from, and that food is adapted to our intestines. We have a 7-meter intestines that is very short. That's similar to a fox or a wolf. That's for a carnivorous animal. Well, we don't have the intestines of a gorilla with a huge belly, 32 meters of intestines, or plant eater like the sheep, also 32 meters. So we need to have also meat in the food, and we're not made for bread or grains that are not sprouted. We're not made for sugar and sweets too concentrated. So we should really, milk products, we're not calves and things. And we see that all the people get all of pathologies. When you go to a paleo diet, don't eat too much proteins in the evening. It looks really, people by themselves get better hormone levels only by doing that.
Oh, wow. That's a great tip. I'll have to try it out. Now, a couple of final questions. You say that in 10 or 15 or 20 years, we're going to be reversing aging in humans. Is that correct?
I believe that next 20 or 30 years, if we're successful here in convincing the doctors, and we'll be successful because we're getting otherwise to a catastrophic situation with very old people who are all retired and no people who are working. So basically too few young people. So we need this, and I believe, I think we can already now, with the tools we have, make people younger 10 to 20 years in time. So one day we'll be able from 70 years back to age 30 or 35. I believe this is really possible, not only with hormone therapies. We'll need to have peptide therapies. Those are little substances made by organs for the organs themselves, and by telomerase activators, which rejuvenate the eyesight and things, but the whole cells. We'll need other techniques. Stem cells also will be in, but if we can combine everything, what we already have, we'll probably already be able to, I think, to rejuvenate 25 years. So maybe if we are able to do that, we'll be able to go back to youthful levels in even an older person.
That's amazing. How can people, Dr. Hertoghe, that are listening to this get a hold of you? How can they find you online?
So I have a website. You just put Dr. Thierry Hertoghe, you'll find the official website. I also have a lot of books published in a whole medical school, training programs for physicians, and that is called the hertogmedicalschool.eu. So you just put hertogmedicalschool.eu, and then you'll find it. And you'll find that much of the information is extremely useful. It's very clear, and it works. And that's what people need.
That's amazing. Thank you so much, Dr. Hertoghe, for coming on my show.
Thank you for letting me speak.